is similar to that of someone who lived in Canada before we had any of the effective health interventions that we have today, before we had antibiotics. And so that's the magnitude of the cost in terms of life expectancy. It's truly a matter of life and death. Now, when we talk about costs, obviously people are always interested in healthcare costs as well. So these are a couple of slides that just show data from a study that we've done in Toronto that show for people that are homeless compared to people in the general population, how much more do they use the emergency department and how much more often do they get hospitalized. And so it's broken down into three groups: single men, single women, and adults with children, adults and families, meaning adults with young children with them. And the number to focus on at the bottom, so that it shows the rate for the people who are homeless, and then the lighter colored bars show people that are not homeless. So the number to focus is the number at the bottom. What this shows is that the rate of use of emergency departments is 9 to 12 times higher among single men and women, and 3.5 times higher among homeless families compared to the general population. And for hospitalizations, a similar pattern, where the men are being hospitalized at a rate almost 9 times higher, the women about 5 times higher, and the families twice as high. So this obviously has huge implications for the healthcare system and really raises the question, I think, of why aren't we investing in housing people rather than investing in taking care of them in the emergency department and in the hospital, which obviously is clearly the way to do it. Now, the other thing that our study, a different study, has shown is that a person who's homeless, once they get into the hospital, it costs more to take care of them for reasons that I think are, again, pretty obvious to all of us. They come in generally in worse condition, and often they stay longer because there are delays in finding a place for them to be discharged to. Now, this may be better in Vancouver than it is in Toronto. This is actually data from my hospital, St. Michael's Hospital in Toronto, where the average hospitalization cost just for all comers to the hospital is $13,000. But for a person who is homeless who comes to our hospital, the average cost is greater by more than $2,500. So by it's a significant increase in terms of the cost per hospitalization. So it costs more, people are being hospitalized more, and it costs more per hospitalization. So let me just go back. So this really obviously raises one of the this hidden cost of homelessness in terms of healthcare is another important reason that we can argue that there is a crisis here. There's a third reason that I think is really important that we be able to convey to people. And this is that homelessness is really, and vulnerable housing, is really a symptom of a larger problem of income inequality. And I think we're all familiar with the concept that made I think, very clear to everyone in the general public now by the Occupy movement, that there is growing wealth and income inequality in our society. And in fact, despite what we like to think about Canada, it's actually growing at a higher rate in Canada than most other developed countries. So this is a slide that just essentially summarizes, I think, a much larger set of research, which I have not done. But I just want to convey to you the fact that a huge body of research has shown that when you look at developed countries, so countries where, like of Europe, North America, where the average income is per capita is above, let's say, $10,000 a year, that it doesn't really matter that much how more wealthy your country gets in terms of the health of your country. What really matters is the distribution of income within your country. So, in other words, the more unequal the distribution is, the worse the health is going to be in your country. So it doesn't help the health of your country, and in fact it may hurt the health of your country for rich people to get richer and for poor people to get poorer. And this is true regardless of how you define health. So if you look at life expectancy, literacy rates, infant mortality, homicides, imprisonment, teenage births, obesity, mental illness, all of these things which we all care about, they're all worse in countries that have higher levels of income inequality. And on the graph, these are countries graphed according to their level of income inequality, with the good old US of A leading the pack on the right in terms of high income inequality. And at the lower left, Japan and the Scandinavian countries. Actually, Canada is right there in the middle. I don't know if you can see it. But there's clearly a strong relationship. And I think that it's really important that we help people to understand that the cost of homelessness and vulnerable housing is not just the individual cost to the people experiencing the problem, not just the cost to the healthcare system, but the cost to society in general. That essentially we can't be a healthy society unless we address the gross disparities in income and wealth in society. So the last thing that I just want to address is the role of research in all this. So here, let me just go back. So I had the opportunity to tour yesterday. I've been to Vancouver many times, and I've had a chance to see places like Insight before. But yesterday I had the opportunity to see many of the Portland, the PHS's other sites. And I think that what I really want to say is that, you know, much of what is really important is not being done by researchers, but by organizations like the Portland and other organizations that are providing housing and supports for people in ways that no researcher has ever done, I think, in most cases. And I think that in many cases, you know, there is good reason to be somewhat skeptical of research. I think that I realize that, and I'll be the first one to admit this, as a researcher, often we are doing studies which essentially show things that you kind of already knew based on either common sense or experience, or we are evaluating things that you already know work, again, from your experience. So what is the role of research? I think that, you know, we have to have a certain measure of humility that we are not leading the way. In a way, we are just kind of helping to show people in a way that has credibility to those who are skeptical of anecdote or personal experience, that we can show using research methods that these interventions, these programs that are being delivered really do make a difference in people's lives. And that's why the Research Alliance for Canadian Homelessness, Housing and Health, or REACH3, is about that collaboration between researchers and community-based organizations like the Portland Health Society, that where we are trying to take our lead from the insights of those who are working on the ground level and on the street level, and trying to make research relevant to you all. So I think that it's just really important that I think we do have a role to play, and I think that sometimes the research studies that we do carry weight in a different way than, or just can reach different audiences in a unique way that sometimes has power, but it really is only in working in collaboration with service providers and people on the ground that we can make research really matter. So I'm not going to really talk about that much, but so I just want to conclude by thanking you for the opportunity to be here, and wish you a really good day.